Today we are going to be discussing what signs and symptoms of dehydration are in nursing home residents. My name is Barry Doyle. I am a lawyer in Skokie practicing nursing home abuse and neglect work throughout the state of Illinois. I'm also the author of Built to Fail, a free report available for download from my website, which spells out how the nursing home business model inevitably produces unnecessary injuries and deaths for nursing home residents. Dehydration is a serious medical issue for nursing home residents. Often it requires a hospital admission to become rehydrated because many nursing home residents have underlying heart or kidney issues, which makes getting rehydrated a tricky and difficult medical issue. In order for residents to get this kind of hospital care, the nurses on staff need to be able to recognize what signs and symptoms of dehydration are. And there are a number of categories in which signs and symptoms of dehydration can be identified. Some of these relate to the visible appearance of the resident. Typically when a resident becomes dehydrated, you will see signs of a dry mouth. You can see poor skin turgor, meaning that the skin is not as elastic as it normally should be. You may see sunken eyes. In addition, there will be behavioral symptoms that will manifest themselves. Most often this takes the form of increased levels of confusion, occasionally increased weakness. Other signs of medical or of dehydration might be medical type symptoms, such as a loss of weight, which is something that would show itself over an extended period of time, or more frequently over the shorter term, you'll see decreased urinary output. The residents are going to the bathroom less frequently and producing less urine. This is an indicator that they are not getting enough fluid coming in. Other signs and symptoms of dehydration might include labs. You'll see in blood tests either an increased hematocrit, or you'll see increased what's known as the BUN creatinine ratio, which is a sign of impaired kidney function, which is often associated with dehydration. When any of these signs and symptoms are present, this is something which requires some consideration of notification of the resident physician, so the physician can make a determination about how to handle the dehydration. Generally, this will take the form of either issuing orders over the phone, the doctor coming to the nursing home to examine the resident themselves, or simply ordering the resident sent to the hospital. However, if the nurses fail to identify that the resident's demonstrating signs and symptoms of dehydration, this is something that impairs the doctor's ability to care for the resident and can serve as the basis of a nursing home abuse and neglect lawsuit. I hope you found this interesting. If you have any questions regarding this or any other nursing home abuse and neglect issue, please feel free to reach out to us. Our number is 312-263-1080. Thank you very much for watching.